Sakthi Dental Clinic, Mullukurechi. Endodontic retreatment is a dental procedure that involves the removal of existing root canal filling material from a previously treated tooth and re-cleaning, shaping, and filling the root canals. It is necessary when a previously treated tooth does not heal properly or if the patient develops new symptoms, such as pain or swelling. There are several reasons why a tooth may require endodontic retreatment, including 1. Incomplete initial treatment. Sometimes, the original root canal therapy is not successful because of missed canals, complex anatomy, or a failure to completely remove all of the infected or damaged pulp. 2. New decay or damage. If the tooth is not properly restored after the initial root canal therapy, it may become reinfected due to new decay or damage. 3. Cracked or loose filling or crown. If the filling or crown on the tooth becomes loose or cracked, it can allow bacteria to enter the tooth and cause infection. During endodontic retreatment, the dentist or endodontist will first numb the area around the affected tooth and make an opening to access the root canal. They will then remove the filling material and re-clean and shape the root canals to remove any remaining infected or damaged tissue. Once the canals are clean, they will be filled with new material, and the tooth will be sealed with a temporary filling. After endodontic retreatment, a permanent restoration, such as a crown or filling, will be placed on the tooth to protect it and restore its function. With proper care, a tooth that has undergone endodontic retreatment can last a lifetime. Thanks for watching. Like and subscribe.